Why is "I don't want to change my doctor" the most common objection? Let's go back to the 1980s. There was a lot of resistance from the healthcare industry to any legislation that was going to lower prices for consumers. And so all of the strategists came up with the idea of let's get people afraid of losing choice over their doctor. And this was pounded into the American psyche through public relations, media relations, from all the big health insurance companies going back 4 decades now. They equated lack of choice, right? This was their big talking point. Lack of choice is lack of freedom, and lack of freedom is un-American. So they tapped into this whole idea that any legislation was going to be un-American. And this has set the groundwork for the conversation that continues to this day. Older adults are particularly susceptible to this messaging because as people go into their 70s and 80s, their world gets smaller and smaller because a lot of their peer group are passing away and they might have health and mobility issues, especially in people served by PACE, mobility issues that keep them closer to home. One of the few relationships they do have is with their doctor, regardless of if they see that doctor 15 minutes once a year. And the doctor is the most trusted role. So people are bringing all of this when they come into PACE, right? And what is the first thing they encounter is maybe a brochure, a presentation, a website, and it's a program. Well, when we say program, a lot of people think social services program, because PACE doesn't really present itself as a traditional healthcare plan. It doesn't feel like the typical healthcare plan in the way we show up. There's a lot of cognitive dissonance and people get defensive and they're going to respond. I am not going to get into the whole branding of PACE 3 ways that we can overcome this resistance. The number one way is to be able to say, nope, you don't have to change your doctor. And there are PACE organizations that allow for visits to the primary care doctor after someone enrolls in PACE. After the first 1 or 2 visits, that participant is so happy with the PACE care team, they don't want to go back and see their old doctor. The second way to break down this resistance is to have the candidate meet the doctor or nurse practitioner before they enroll on their tour. We're asking someone to give up a relationship. We should be able to bridge into the new relationship. We want to reduce uncertainty. Then the third best way is to embrace this resistance in the enrollment conversation. We cover this in our empathy enrollment training, and you are welcome to DM me and we can talk about that. I hope you like this bit of historical context. What I'd like you to share in the comments section is reasons participants have told you that they don't want to change their doctor.